All right. Hi, everybody. Good afternoon. Thanks for coming. I know it's a little bit smaller crowd. We're testing out the Livestock University sector, farmer to farmer. So I want to make this really personal. If you have any questions, just stop me at any time. My name's Dr. Erika Nagorske. I'm a veterinarian at Southwest Veterinary Services. We're based out of Worthington, Minnesota, and we're the official partner for FBN. So a little bit more about me. I'm a dairy calf feedlot veterinarian. Again, in Southwest Minnesota, we kind of practice, we're really close to Iowa and South Dakota, so we have a nice little radius in that part of the state. I'm really passionate about cow comfort, animal welfare, and calf care. I'm originally from Wisconsin, go Badgers, but went to undergrad and vet school at Minnesota, where I met my husband, who's a grain farmer in Southwest Minnesota, and convinced me to move back there, where the wind does not stop blowing. And I got two little kiddos at home, Jack, who just turned 2, and Madison, who was born in August. So that's just a little bit about me. So an agenda for today, I'm going to review dry cow management, talk about selective dry cow therapy, why we're here today, right? And then a little plug on Bovikalc Dry, which is a product that's been out for probably a year and a half. So a refresher on the dry cow period and management, right? So the dry period is a really important phase of the cow's lactation cycle. It's going to greatly affect the following lactation's production. It's that time for her to relax. I picture it as a vacation. Sometimes it's not a vacation. So the goal is for a smooth transition. Okay, so that's environmental, physical, and nutritional, all three of those things. Dry off is extremely important for udder tissue. You know, they'll have a 25 to 40% reduction in milk production if they don't have a dry period. Everyone's had that cow that they forgot to dry off, or the breeding date was wrong, and boom, she calved, but she was still in the milking string. We know she does not perform that next lactation like she could. It's also a really important time to resolve any subclinical mastitis. So current dry off methods, there's a couple that are out there. Gradual dry off, which is my personal favorite, would be similar to calf weaning. So it's really beneficial for udder health, right? It's a slow decrease in milking, just to give her body time, because we have genetically created these milking monsters, right? So it's hard to turn them off. Abrupt dry off, which I believe this was 2014 NOMS data, said that 80% of the herds in the US do this. I'm assuming it's a little bit less now. And then feed restriction, which is my least favorite, which drastically will reduce milk yield, but can cause some pretty significant behavioral issues for the cows. So this is a really nice flow chart that I like. It talks about the impact of dry off. So you can see we're drying them off. There's milk retention, especially depending on how you're drying those cows off with gradual or abrupt. You can get udder engorgement and an increased risk of milk leakage, which both can lead to discomfort, mastitis, decreased lying times. They're both animal health and then welfare concerns. So when I think about environmental transition for our dry cows, you know, where is she going and how long is she going to be there? Do you have a close-up group and a far-off group, one dry cow group? What is the flow on your farm? And social aspects, right? These are herd animals. We all know they're super social. They have pecking orders. Is the boss cow in the group going to create a problem if she gets moved a bunch of times before she calves? They need enough space, so 50 to 100 square feet of bed pack space. And that's just so they can choose to lay down where they want to lay down. They can interact how they want to interact within the pen. Enough bunk space, water accessibility, a dry environment, which is really important for udder health, right? And then heat abatement. And I have a little bit more about that, I think, later in the presentation, but there's a lot of new studies coming out that cows that are under heat stress during gestation, their calf will perform at a lower production rate. So their calf actually will be affected, even though they weren't directly, you know, they weren't alive when the heat stress was happening, but there can be an issue with that. Nutritional transition, can't forget about this. probably one of the more important pieces of it. So working closely with your nutritionist to fine-tune your dry cow and transition rations. Our DCADs, dietary, cation, anion difference, right? Make sure that's fine-tuned to reduce milk fever prevalence. And then monitoring your success with your fresh cow diseases. Okay, do you have a lot of DAs, retained placentas, ketosis, mastitis, milk fevers? How are they transitioning? Their disease rate will tell you how well they transitioned. The physical part, and this is where the dry cow antibiotic tube comes in, is another piece of the dry off. So udder comfort milk production, but then the vaccines. This is a common time to vaccinate your cows to hopefully pass some antibodies to their calf through the colostrum. You'll have your dry cow antibiotic, plus or minus, which is what we'll get into next, and then a teat sealant. And then here's a little note on heat stress. I found this interesting. The average cow in the US has 96 days of heat stress. So that's 3 months, right? So a fourth of your year, your cows are under heat stress. So a fourth of the calves that are born, could potentially have negative effects from that heat stress event when they were in utero. And it's not that hard to heat stress a cow. Above 72 degrees and 50% humidity. They love 50-degree days. They could be at a 50-degree day all year. But the best way to reduce heat stress is ventilation. And housing design is really important. Cooling systems, fans, sprinklers, water soakers. And I find it's really common, we always forget about heat abatement on the dry cows, right? The milking barn feels great, but we get to the dry cow barn and it's really stale. So whatever means are possible, because it can affect that calf's productivity. Let's see, I talked about some of that stuff. So there has been some studies on the human side, like with the potato famine that came out. So this is where we're kind of extrapolating some of that, and I think why the dairy industry is looking at it. So families that had ancestors in the potato famine, their metabolism genetically changed because of that, and they've actually passed it on to like multiple generations. So if we stress the cow in some way, shape, or form, she does have the potential to pass that on to following progeny and so on and so forth. So I thought that was really interesting on the human side, that they were finding these genetic changes in metabolism like generations later that did not go through a famine themselves. Okay, now we're going to chat about selective dry cow therapy. Does anyone have any questions on the basics of dry cow management? Okay. So we're going to talk about definitions, the general use, pros and cons, protocols, and then a little discussion. So selective dry cow therapy is the individual selection, right, selective, for intramammary antibiotic at dry off based on the previous lactation, somatic cell, and mastitis event. Blanket is where everybody gets it no matter what. So UW-Madison has a good quote that the goal of selective dry cow therapy is so the producer can reduce overall antibiotic use without having a negative impact on milk quality. And I think that last line is the most important part because we don't want to affect milk quality. That's how you make your money. Milk quality is correlated to how well your cows are doing. So we want to make sure this is a good fit if this is something you want to try. So why do we do it? Why do we give them an antibiotic at dry off? And when you think about it, we're stopping all the preventative practices that keep them from getting mastitis. We're not removing milk anymore, okay? So we just turn off the faucet. We're not doing pre and post dipping for an antibacterial effect on those teats. There's a change in environment. Is your dry cow lot a mud hole, or are they going into a barn or, a bed pack or sand-free stalls? What's the change? The teat canal will shorten during the dry period, and that makes it easier for the bacteria to get up, right? Because they have a shorter path to get up into the udder tissue where they cause trouble. We all know there's immune suppression around calving, so a smaller dose of an infection can, easily affect a cow. And I think this is interesting, the keratin plug. So keratin is just a fancy word for like skin cells, I guess you could say. So cows naturally should have a keratin plug when they dry off, right? Or when they're not lactating anymore, to stop bacteria or other things from getting up into their udder. Since we've genetically, or continued to breed for these really high producers, the keratin plug has a really hard time forming now in our cows. So 6 weeks in the dry period, they found that 1 out of every 4 cows still has an open teat. That's significant. I didn't really realize it was that predominant, but that can cause a problem for your mastitis during your dry cow period. So, and again, this NOMS data is a little bit old, but blanket therapy has been a really standard part of mastitis control programs. In 2014, it said 90% of U.S. dairy herds do blanket treatment. I'm sure that's changed by now since there is a lot more discussion on selective dry cow therapy. It's really important to reduce the risk associated with subclinical mastitis in fresh cows. It's, the opportunity to treat that cow before her dry period so she won't calve in with a mastitis case. Obviously, if they have mastitis right away when they freshen, they're going to produce less milk, and they're probably going to get it again later. I think we all can agree with that. So pros and cons for blanket treatment. These all make sense. Like I hit on, it can cure existing and, prevent future infections, the one-time use early on. Does that mean there's a reduction in antibiotic use? Kind of hard to say. Increased mammary health in the herd because everybody's getting it, right? Cons, of course, are expense for everybody getting that product, labor, potential risk for bulk tank residues, and then antibiotic resistance. I think that's kind of a stretch, but it's something that's been coming up in the livestock sector for continual use of antibiotics. Does that breed resistant bugs? Pros and cons for selective dry cow treatment. So again, individual selection based off the previous lactation somatic cell, and as well as any mastitis events that she had, right? So pros, you're going to reduce the risk of bulk tank residue because you have less cows that are treated. Reduce drug costs, which is a big one. Reduce antibiotic resistance, I don't know, just something that's been talked about as an industry. Cons, you're removing the opportunity to cure an existing if you don't know about it, or, preventing a future mastitis event. And then the extra labor efforts. I think this is the big piece that hangs people up is taking the time and having the data to identify which cows are eligible for this. So here's this big, awesome flow chart, and I'll try to break it down simple for you guys, but it starts with the herd level criteria. So is your bulk tank above or below 250? And that's just the first, this is where we need to start before we talk about this. If it's above, we're not going to talk about it right now. You're just going to blanket treat everybody. If it's below, this is where we can start talking about individual assessment of your cows. So do you have monthly somatic cell tests from your cows, and do you have mastitis records? If you can identify who's high or low somatic cell and when they got mastitis last, that's the next, point where you can go down to cow level criteria. So from there, if you've identified your cows, since you have the information and the record keeping, are they above or below 200 somatic cell? And have they had any clinical mastitis in the last 90 days? If that's yes, then you go to blanket treatment. If it's no, then we go on and we discuss the California milk test as an option. I have had some farms implement this, and they honestly skip that step because they feel they have a pretty good cow level criteria up until then, but I think it's beneficial to know that that can be part of your protocol. So everyone knows that little white paddle that's hanging in the office that no one probably uses anymore, but it's a great tool you can use just to check, every quarter to see what ballpark the somatic cell is depending on the precipitate with the mixture in the dye. I'm going to touch a little bit on teat sealant because this is an important part of it as well. There's a couple options out there. Obviously the internal is more superior than the external because the internal is just acting like your natural forming keratin plug. It lasts longer. You know, there's studies that show it can reduce the risk of mastitis by 73% compared to untreated cows. And again, it just makes sense. They're blocking any bacteria or, you know, dirt or poop from getting up there. Paired with antibiotics, 30% less likely to have mastitis event, which I would say is not that much. You'd think it'd be more, but that's a little bit on teat sealants. So at the end of the day, why does selective treatment work for dry cow therapy? And I think this is something we all have to keep in mind, is that not all mastitis cases need treatment. And I'm guilty of it. I know all my producers are. It's really easy to see abnormal milk and get excited, you know, because 15% of those cases get really bad, and we don't want to wait to find out if she's going to be the 15% or not. So they're usually mild to moderate because they're environmental pathogens. So learning to treat mastitis differently depending on what bug it is. But again, this usually takes culturing and a little bit more labor and management than typically. The pathogen-based approach, so culturing and testing these cows or checking your bulk tank, can reduce antibiotic usage by almost 70%. And again, you're eliminating those cows that it's just an environmental bug that they're going to get over on their own when you know what bug it is. So what? Why do I as a veterinarian care about this? I think the big thing that hits home with me is I feel like this is going to be mandated someday. So let's get good at it now. So when we have to do it, you know, we're prepared and we've worked the ins and outs of it and we know what's going on. You guys, I'm sure, are familiar with VFDs, the veterinary feed directives, which is where a veterinarian has to write a prescription for a feed grade antibiotic. They're going to be taking away over-the-counter meds, so you're not going to be able to get penicillin or Oxytet in runnings or Tractor Supply in the future. They're constantly updating medically important antibiotics for the human field, because at the end of the day, you know, if we're choosing a drug for a cow or a human, the human's going to win, right? Update and duration and use for water meds. You know, water meds kind of right now are more of an open label, but I can see that being more defined. There was one presentation I listened to reference that Florida and New York might lose dry cow therapies. I feel like that was kind of a stretch, but it's floating around out there, so that's kind of scary. And then Europe has already lost all blanket treatment, so they have to do selective dry cow therapy. So we're usually, 15, 20 years behind Europe. So I bet in my practicing lifetime, we will see this. But doc, we need it. One of my favorite quotes from my clients. But do we? I mean, our cows are healthier, right? And we're better managers. You can even see from, 1997 to 2014, the national average for bulk tank somatic cell dropped 100,000 points or cells. Like that's significant. We're getting better at what we do. And, from 1995 to 2016, it went from, a quarter of our dairies having over 400 for somatic cell to only 11. So we're getting better. We're better managers. Our cows are healthier. We're learning how to manage our cows better. So is this for you? Again, that flow chart talking about a bulk tank somatic cell. This says 200, but I think 250 is a good place too. This tells you that your mastitis cases are manageable on your farm, okay? If you start creeping up to 354, your mastitis cases have not been manageable. Limited contagious mastitis pathogens. So if you're a Staph aureus farm or you have strep egg pop up, this is a scenario where we'd maybe hit the pause button on selective dry cow therapy. And let's do once a month bulk tank culture just to see what's floating around your farm, especially if your somatic cell starts to creep up. Good relationship with your herd veterinarian and the ability to follow protocols. And then, of course, exceptional record keeping. So knowing who had mastitis when, what kind of cow or what kind of lactation she had, and just knowing the ability to decide who gets an antibiotic and who doesn't. kind of hit on all these things with willingness to perform diagnostics and surveillance on your farm. Excellent dry-off technique, whoever's drying off your cows. If we're not using an antibiotic, that's kind of a Band-Aid for, to be honest, a crappy dry-off technique. So you want to make sure that you're clean, you're using those alcohol wipes, just proper technique during that entire situation. And then excellent dry cow facilities is also a really important part. Let's not get super excited about selective dry cow therapy and then, forget about the rest of the dry period. I am going to touch a little bit on economics, and of course, this can be different for every farm and with how the markets have been, who knows. But I would say the success of the selective dry cow therapy is very farm dependent. In some papers, they reference a reduction in dry cow therapy costs by 20-30%. I've had some farms and some other practitioners, classmates of mine, say it's closer to 50-60. I think it really depends on all the dry cow things we talked about earlier. General mastitis economics, a clinical case, which this is probably an old number at this point, is $400 to $600. So you do want to manage your mastitis. Your direct and indirect costs with your drugs, the labor, the lost milk for a while, all those things can add into your mastitis program. So just keeping those in mind while you decide if this is for you. Dairy Star had an article that referenced almost $7 per cow saving when 35% of the cows were treated with dry cow antibiotics. So again, that means that their reduction was 65% reduction on their herd. So kind of, again, depends on the cost of your drugs, your farm, and how many you decide to treat or not treat. So in conclusion, I definitely think more research needs to be done to kind of have a consistent idea of the economic benefits of this. And what are the success factors for farms that can do this really well. And unfortunately, or fortunately, however you want to put it, I think it can be a good thing. Start thinking about what selective dry cow therapy looks like on your farm, because it can be mandated someday. Any questions, or I'll just go into Bovikalc Dry, unless anyone has like a burning question right now. Am I boring you guys to death? Okay, I'm really excited about this product. This is not a plug for BI, but I think this product has a good place in the marketplace, especially if we can't gradually dry off our cows, or if we just have really high producers that don't know how to shut off the valve. So what is Bovikalc Dry? How does it work? What are the benefits? And is it a fit for your operation? So again, dry off refresher, it's really important for the udder tissue. It's a opportunity for that udder tissue to rest and regenerate, an opportunity for subclinical mastitis to resolve itself and set that girl up for the next lactation. Here are the current dry off methods. Again, I think Bovikalc Dry is a good example for an abrupt dry off for what it does, which I'll go into next, compared to a gradual dry off. But maybe we still have some cows that are milking, 80% of what they usually were after they've been on a gradual dry off for a couple days. You guys have seen this slide. Again, impact on cow welfare and cow health, which is extremely important for the next lactation. Okay, what is this magical Bovikalc Dry? Have everyone heard of this or no? You guys raise your hand if you've heard of Bovikalc Dry. We have two. Keith Pedley, you have. Okay, good. Pretty much everyone. Well, we'll just review it a little bit more because I think it's still a really interesting product. Is anyone using it? Nope. Nope. Okay, so what is it? It's a mineral supplement for cows that dry off. It's just like the traditional Bovikalc, but it has ammonium chloride in it. They did change the marketing with a nice red top, so you could tell the difference between the two. It will not hurt cows if you give a fresh cow Bovikalc Dry. I mean, it obviously will tank their milk a little, but it's not going to cause any huge harm, or vice versa. So the ideal protocol is 2 boluses given at dry off, 8 to 12 hours before dry off. I know BI is doing some research and figuring out, what does one look like, what is one now and one later, and kind of the different timing depending on your system that this product could potentially fit on your farm. So it creates a change in the metabolism. The original marketing called it acidosis, which made all the veterinarians in the room really nervous. But essentially, it does cause a change in the metabolism, which reduces milk production. And it's a really sharp 24-hour dip. But then that girl can kind of, continue to dry off into the sunset. You reduce milk leakage because of that, reduction in udder pressure, which makes sense, and you're going to promote cow comfort because she's going to want to lay down. So here's a little graph. You can see cows that didn't get the bolus just kind of kept swimming, and cows that did get the bolus had a pretty significant drop within a day or two. And then even at one bolus, there's a little bit of a drop. So I think we got to do more research, but it really depends on how much they're milking and a couple other factors, but there is a statistical difference in milk production if they get a bolus. I like these little graphs. So this study showed the lying time. So the graph on the left, you can see the control is in gray. The bolus cows are in red. And at 24 hours, your control cows, or leakage had 12 leakages, and your bolus cows only had 5. So again, leakages, which are directly correlated to how much milk is probably, being engorged in that udder. Less leakages, less chances for bacterial infections, all the above. And then the graph on the right is lying time, and I think this one's important too, but you can see there was an increased amount of lying time if they were given the bolus. They're more comfortable. They're going to want to lay down instead of laying on a nice big engorged udder. So Dr. Gordon at ISU did this study. It's very attractive and it looks good, but I think we got to do more studies like this. So this showed an 11-pound difference in milk for the next lactation for cows that got Bovikalc Dry at dry off. Again, do I believe? Absolutely, I believe there's going to be an increase in milk production. Do I think it's going to be 11 pounds? It'd be great, but I don't know how consistent that is. But it just leads into, we gave that udder more time to rest. We gave that cow a better transition. She's going to perform better for you the next lactation. So I threw a little economics on here. Honestly, I can't even remember when I priced out the cost of the bolus for this slide. But let's say it's $14 for a treatment. What's the value of 11 pounds of milk? And then importantly, the value of cow comfort and potentially reduced somatic cell at freshening because she didn't have such a bad udder reaction to dry off. So I think you're going to be able to pay yourself back. It's just figuring out the management and when you're going to give that bolus and how at your dry off period is the question. So in conclusion, there's tons of management decisions like we just talked about that affects the dry cow period for our cows and therefore their subsequent lactation. Every farm's super different. What works for you might not work for your neighbor and vice versa. But I think I've learned, and I think everyone in this room would agree, if you focus on cow comfort and health, at the end of the day, the production's going to follow. If you keep them happy, healthy, and fed, and stress-free, they're going to milk for you. Any questions? Huge brain dump. Say that one more time, Keith.
So when they had the milk leakage chart,
Yep.
did they use any teat sealant?
Yes.
Oh,
Yep.
okay.
There was a teat sealant used in that study. Yep.
So when you say the blanket coverage, is that teat sealant and an antibiotic, or are they doing just teat sealant?
Correct. Yep. Teat sealant and antibiotic.
Okay.
Yep. I mean, I think that, and there's some farms that just do the antibiotic and don't do a teat sealant and what have you, but most of the studies they're doing both together. What else? Has anyone tried this on their farm yet? If they want to be shy or not shy. I have one farm that's doing it out of 6 local dairies that I do consistent herd work with. And it's going well. They have really good dry off facilities. I think that's or dry cow facilities. I think that's the ticket. can't hear anything. I feel like this light is making me go deaf.
It's just finding somebody to give that pill to them.
Keith, say that one more time. Shout.
You got to find somebody to give them the pill.
Correct.
Yeah.
Yes, exactly. So that's the, depending on when you dry off your cows and how, you know, especially if you have to give it once and then again, they're playing with different protocols 12 hours later. Who wants to chase a dry cow in the dry cow lot without headlocks? Like, or give it in the parlor. That's not fun. But
So on that, when you're given the 12 hours later, would it be better to give, instead of trying to chase them down the dry cows, could you give it 12 hours prior to dry off?
yep.
And then give it at dry off, that way if it's on a different facility, like for me, it's on the same facility.
Correct.
But prior we weren't, and we weren't gonna go chase them at another farm.
Yep.
That's what I was wondering.
Yep. Yeah, absolutely. You can, and they're working. I've spoken with the BI Tech Service Vet. They're like trying to figure out different studies to see, how much better does it work. But I think that is a totally acceptable protocol, because then it gets done. Yep.
So then the study that you had, that was done 12 hours after dry off?
Yes, I think,
Correct.
or no, it was two given at one time, 8 to 12 hours before dry off. Hold on. If I can find it. 8 to 12 hours before dry off. And again, there's all kinds of different protocols that they're starting to float around. One 24 hours before, one at, all the above. What else? 11 pounds would be pretty nifty. But I think more people would be implementing if it was really that good and that easy, but. Anything else? Well, thanks. I'll be around. My name's Erika. I'm here till Thursday. Thanks for coming. Yeah, enjoy the trade show.